Hi, I'm Gil Kennedy, President and CEO of Har-Co Credit Union. Today I have the true pleasure of interviewing Chuck Moore, Police Chief of the Town of Bel Air. Welcome, Chuck.
Thank you very much, Gil.
Well,
Nice to talk to you.
I certainly appreciate it.
Mm-hmm.
Tell me a little bit about yourself. Tell me about yourself and then the role of the police chief in the town.
I've been a Harford County resident my whole life. My families go back several generations in Harford County. I think the first time that I really started to become impressed with a law enforcement background is when actually my family was a victim of a burglary when I was a young boy, and a Maryland State Trooper pulls up on the scene, and I'm like, that guy looks really sharp in that uniform. And from there, it kind of escalated and evolved, and the next thing you know, I'm in the Maryland State Police Academy in June of 1988. And from there, my career continued for 26 years, kind of jumping around all over the state. I finished as a captain with the Maryland State Police at headquarters, kind of doing some statistical work and supervision of a new dispatch unit that was there. And I also, while in the state police, I was temporarily assigned at one point to be an interim police chief in Perryville, Maryland. And that's kind of where I got the itch to maybe look into a police chief job. Things kind of fell where they ended, and I next thing you know, in 2015, I'm the chief and the police chief in Bel Air after retiring from the Maryland State Police. So that's it in a nutshell. There's a lot of little moving parts in the middle there, but I'll keep it short for you for time's sake.
So, what does the role of police chief entail in a town of Bel Air?
Well, Bel Air is not enormously large like many people think. We encompass one specific zip code, not two. So basically there is a Bel Air proper, which is 21014. We are not involved, or the jurisdiction does not include 21015 and many parts of 21014. We're actually only 3.2 square miles. We have over 10,000 people as part of our population. So we're relatively small, so a lot of times being the police chief, I am the chief cook and bottle washer, as you say, the saying goes. And a lot of times I'm involved in many different things, including going out handling some calls for service if patrol is short. I might end up sitting in dispatch to give our dispatchers a break. And then, you know, the 5,000-foot view is that I've got to try to make the quality of life in Bel Air as best as possible, which includes oversight of all the criminal activity that happens in the town of Bel Air, because in the small town, we're a municipality. We have our own police department. We're responsible for everything that happens criminal-wise or safety-wise with a criminal element or a traffic safety element attached to that. We're responsible for that. So maintaining the overall quality of life is my overall responsibility. So monitoring the crime, comparing the stats between one year to the next to see if there are spikes that we've got to pay attention to, if there are a higher number of crashes occurring at certain locations, addressing that, whether it's through engineering needs or more traffic enforcement, or touching base with the community to see if there's another problem that we might not understand totally. So, I mean, it's a whole gamut of things that I'm responsible for. But again, maintaining and ensuring that the overall quality of life for the citizens is my primary goal.
Well, you all do a wonderful job, and we're
Thank you. We try.
Grateful for your support
Yep.
and your efforts in making our community safe. So, do you work with the other police departments in Harford
Yes.
County, the county police department, Aberdeen, and?
We do. We communicate regularly. In fact, we have a police commission meeting tomorrow where all of us kind of compare notes and go over quality of life issues, or any kind of issue for that matter, that maybe one police department can help with resources, sharing, that kind of thing, or brainstorming on a problem. Yes, we work closely with all of them. Yes.
Well, you know, mid-March was a inflection point that changed the way our normal lives went. So how has your department and policing activity changed during this period?
There has been a whole lot of things that have happened this year that have seemed to change the outlook or perspective from police departments all over the country. Who would have thought that we would be facing a pandemic, COVID-19 issues? Who would have thought that we would be looking at that at the beginning of the year? But I mean, that's life. Things twist and turn and change quite frequently, and police departments to stay part of the community, to be successful, you have to be able to change with the times. So yes, we've certainly changed because of the COVID pandemic, and we instituted a bunch of steps that I think that helped us kind of navigate that perilous little journey there that we continue to feel right now.
What were some of those steps that you took?
So some of the steps that we took, of course, we and again, we're a small department, and we have to watch what's going on nationwide, locally, statewide. We have to keep in touch with all of our partners in the healthcare business, and in the state government. Because March 5th is when the governor instituted the first executive order that says, hey, these are the rules and laws that we have to follow to make sure that the impact of COVID-19 is not going to impact us as much as we can help it. So here is the rules, here's the laws, and I'm divvying it out to all the jurisdictions, the municipalities, the counties. Here are the laws, and it's up to you locally. It's up to the officials statewide to make sure that these laws are followed. And then you have the Maryland Department of Health, who are also involved, and our local health departments, and they also have rules that we have to stay on top of. We've all of our institutions, all of our establishments, businesses, they've done a great job in the town of Bel Air. Of course, there's been instances where we've had to pay visits to some of these locations and say, give them a little reminder that, hey, we're starting to see some things here that make us concerned, and we're all, the cliche, we're all in this together, but truly we are all in this together, and we have to do our best to lessen the blow of this thing happening, and everybody's been extremely cooperative. We haven't had to go out 2 or 3 times to these places and remind them. Once we stop in and they see us, whether it's, sometimes it's my job, this is my town, I'll go in off duty to see what's going on, and whether it's business, whether it's, I guess maybe a little selfishness when I want to go in and enjoy a good dinner because we have great establishments here, or maybe an adult beverage here and there. I just see everybody doing their best to conform and make sure that this COVID-19 hits us as little as possible. And I think we've done a great job on that.
Yeah, and I believe that, this county and our town really has abided by the social contract.
Yes.
We all need to, we have an obligation to not only ourselves, our families, but to each other.
Absolutely.
And, it's, you talk about the executive order, so, and I never thought about it, but the executive order aspect is another set of rules and regulations that you all had to become familiar with, in addition to the laws that we have on our books currently.
Yes.
I never even thought about that. That's very interesting.
So the big thing, again, it's, and again, there's been probably a dozen or more alterations, iterations, amendments, etc., that myself and all the leadership in the town, the commissioners. Now remember, our commissioners, it's almost a voluntary position. They get paid very, very little for the tremendous amount of work that they do here, and mostly they're involved in all of the and all of the communications. I mean, when the pandemic, and I think it's a pandemic, right? Not an I always get that confused, but anyway, when it first started, we were having weekly, daily meetings with officials all over the state, and our commissioners, our town administrator, our leadership, all of our leadership was on these messages, and we had to adjust an incredible amount. We had to expend an incredible amount of effort to stay on top of that, including making adjustments to keep our employees safe, from this, because we're in the business of public service. We're interacting frequently with people. We had to institute steps, create policies. We personally, probably 7 or 8 different policies we've had to create with instructions for our employees on dealing with a person that could be, that could be exposed to COVID, or could be a COVID patient. Mm-hmm. How do you deal with this kind of thing? We had to do that to keep our employees safe. We actually adjusted schedules to reduce the chance of exposure. Less employees here means, if we do have an exposure, less people get exposed to it if we don't have as many working. So we've had to do that. And again, going out and ensuring that establishment and our public and our community is doing the best that they can to reduce the chance of COVID impacting our town. And I think it's gone very well. We've had a couple very close calls in that arena, but we've navigated it. And I think because we've stayed on top of things, it has reduced our chance of getting, knock on wood, impacted here in the town of Bel Air. Because really, we're responsible for everything in the town, and if our pool of employees is impacted by something like that, it's going to hurt really bad.
The consequences of
absolutely
something happening to your department.
Mm-hmm. Yes.
Has implications.
Yes.
Thinking back to prior to March 16th,
mm-hmm.
March 5th, that timeline, opioid addiction was paramount in efforts to control.
Yes, sir.
That.
Yes.
So talk. Obviously, that didn't go away.
No.
But talk to me a little bit about how that has continued to be something that is critical to deal with.
Yes, the opioid issue is something that is still of paramount consideration for me and the department here. I think I truly, even with you, I don't think anybody has not been touched by the opioid epidemic out here. And it's, I think really, it started to really affect me around 2017 when the number of opioid overdoses really started to climb. Substance use disorder really started to get on my radar when I was going to some of these calls for service in our own town. And, I've done this is 32 years, but there's a point where, you see a young man or young woman lying in a bed who just died from an overdose, families running around screaming, little kids running around screaming and crying. We have a tendency as law enforcement officers to become a little bit hardened. And, there was a point where maybe I had passed that, and I saw my officers starting to pass that point too, where it was starting to affect their morale, that they were going to 2 or 3 overdoses per week. And, we decided that, look, again, the 5,000-foot view is the quality of life here in town, and it was starting to deteriorate the quality of life in the town of Bel Air. So at the end of 2017, we ended up with 33 overdoses and five fatalities that year. So we started, the protocol at the time when you have an overdose was to give them a card, to give the person that overdosed a card, say, here, call this number if you want to get help. And, these people that are, starting to communicate with other law enforcement leaders and to get the bigger picture, you realize that, hey, they're not likely, going to use that card. You have to use a little bit more horsepower, a little bit more of a pushing kind of thing to go into the program. to push that person in the direction of recovery. So what we started a new program. We called it DART, and I'm not going to take credit for it. It was actually instituted initially out in Cumberland, Maryland, but because chiefs communicate, we have these, we have conferences and things. I got the idea, and I with permission, I stole the idea from Cumberland, instituted it here, and it started in January of 2018. So basically, what that program is, when an officer goes to an overdose, whether it's in a hospital setting environment or at a home environment, they kind of say, hey, look, here's the program that we have here in the town of Bel Air. We'll get you behavioral health assistance as quickly as possible. All you need to do is just sign here. And then the program evolved to where we try to get the officer away, because when they see a uniform, that's an instant turn-off for most people. But, and you also have to get buy-in from your officers. And I was pleasantly surprised that most officers, they bought into it, and they started to do the program. And we started to get participants. So when a person agrees to participate, behavioral health gets involved, Family Children Services, Harford County Office of Drug Control Policy. We formed a little coalition. Another cliche is the silo effect. Before you had the behavioral health professionals, they were over here, law enforcement was over here. So we started to work together, and the level of enthusiasm from that sector, I was also very surprised at. They were like, yeah, well, we want to help you. Let's get to the front of this thing. So we started to get participants. Behavioral health was there. They had a case manager that would get that person the service that they need. And a lot of times, these addictions, they're related to other trauma that might be in the person's past. Mm-hmm. So that's what their specialty is. They're experts. Get to the bottom of why this person is, why they're addicted, why they're doing opioids or other drugs. So at the end of 2018, we were actually down to 20 overdoses from 33 total overdoses, but we did have more deaths. So it's not good enough. Any overdose or any death is not good enough. So we continued at the end of 2019, I believe, and I'm doing these numbers off the top of my head. I think we were down to 6 overdoses with 1 death. So another way to measure the success of that program, and I don't do a program just to say I'm doing a program, okay? 'Cause I'll stop if it's not working. So we know that there is a prevalence, there is an abundance of Narcan out there, which of course, that's a godsend for us, and it's reduced the number of deaths, and it's out there, so anybody can go get Narcan if they have a substance use disorder. So of course we were factoring in, well, maybe these reductions are as a result of Narcan. But when you start looking before the prevalence of Narcan and studying the number of overdoses happening elsewhere, it seemed that when we compared current numbers, our overdoses were lower. So it looked like Narcan, of course it had an effect, but sure, it looked like something else was working in there too. So we like to think that the program is successful. Now, we go to 2020. You've got the COVID stuff going on, the pandemic. Now you have the opioid stuff. What do you think is happening with the number of overdoses? Yeah. They're starting to go up again. They're starting to go up again. Now, again, just as I said, people that suffer from these disorders, a lot of times there's other things that's causing that. Depression, employment, isolation from others. All of that stuff, is things that these people have suffered from disorders before. They're starting to go through that again because they can't go to their methadone, they can't get Suboxone, these things that help them navigate into the realm of recovery. They can't get access to that. They can't go to their meetings to discuss things with peer recovery coaches, the people that have recovered and that are helping them. They can't interact. So we are seeing an increase. We're up to 10 this year with 3 actual deaths. Wow. So I think I think that could be a sign of COVID actually impacting the opioid problem. Now, another thing that we look at is repeat overdoses. Before we started our program, we were having repeat overdoses I think maybe we've had 1 or 2 over the past couple years. So I think that's another sign that we're on the right track.
Sure.
And with other things going on in the country as far as the community saying, hey, maybe we need some more therapists involved in law enforcement. And you know what? I don't disagree with that. I don't have a degree in behavioral health.
Sure.
So let's include them in that stuff. So we actually expanded DART to another program called LEAD, Law Enforcement Assisted Diversion. So with that new program, which ironically just started last month, low-level criminal offenders, we're going to try to get them help through the same avenues that we did with DART, through behavioral health experts, get them included in the process, and try to do something different than the traditional cycle of arrest. When you have somebody that committed a crime, low-level crime, you arrest them, you book them, you prosecute them, you sentence them, and then they're incarcerated, then they might get behavioral health. So with this program, low-level crime, low-level criminal, as we can call them, let's say somebody committed a shoplifting offense, we could say, hey, and they're a Town of Bel Air resident or they live pretty close, we'd say, hey, here's this new program. You have to come to one session and talk to a behavioral health person to try to get you help. If we think you have a problem, it could even be a financial problem.
Sure.
You might have a kid, 18-year-old kid, who needs cleats for football practice. He goes in at Dick's and steals a pair of cleats. In the old system, they get booked. He or she gets a criminal record. They go through the system, and nobody addresses the real problem that caused him to go there and steal those cleats.
Right.
So with this program, we can possibly get that person help, not give them a record, save money with the prosecutorial stuff, not get them involved in an environment where they're talking to other people that might lead them further down the road to crime. So that's the new, I guess I'd like to say, improved version of DART. So we're not calling it DART anymore, we're calling it LEAD now.
Well, it sounds like you were in the cutting edge of that, and bringing a broader definition to public health.
Yeah.
More than just COVID,
Mm-hmm.
and finding and redefining how policing and support of the community is actually implemented.
Mm-hmm. Mm-hmm.
It's a tribute to you and your staff.
Well, thank you very much.
I'm so glad that the town of Bel Air has somebody like you.
It's a new concept, and again, if it doesn't work, we'll stop doing it. But I think
you're on the right path.
I think we're on the right path. I think that's the new style of policing that we might end up going towards.
Well, we certainly appreciate that
Yep.
in the community. And I know I appreciate that as
Thank you, sir. I
the
appreciate
leader
that.
of Har-Co Credit
Yep.
Union.
Yep.
And being right across the street from you all makes us even feel more safer.
Yeah.
To wrap up, what would you like to leave with in the form of a thought or perspective for my members and the community? I'm a guy that likes this. I like to look at history, and there's this guy named Robert Peel. I guess you could say I'm kind of like a Peelian kind of law enforcement authority, in that he believed that the community basically is part of the police department, and the police department is part of the community. Okay, we're out here to serve. So if there are things that the community doesn't like from the police department, and we're kind of seeing that across the country, with some, with society maybe wanting some change in the police departments, we've got to conform to that, and that's the kind of thought process that we follow here. And again, making sure that the best quality of life out there as possible for our citizens is paramount to us. That's a prime consideration, and being kind to the community. And again, the message is, you're part of us, we're part of you. We're only getting paid for this job, you're not, but we just want you to realize and recognize that and appreciate that. And mostly, our citizens totally appreciate our police department and the services that we give here. That's what I've seen. It was a little different from where I came from the Maryland State Police. It's a different perspective. I wasn't used to officers getting to calls within, if it's 4 or 5 minutes to get to a call for service, that's a long time. Mm-hmm. So I'm pretty proud that the officers here
They take pride in that. And they do law enforcement a little bit differently than what I was used to, and they've taught me a lot, actually. So,
Well, we're so fortunate
yeah.
to have you and your staff.
Well, thank you, Gil.
Appreciate
I
that.
appreciate the opportunity.
This has been wonderful.
Yep.
I want to thank you again for gracing us with your with this interview.
Anytime.
And I'd like to say to our members and to the community, please like us on Facebook and please share this video with your friends and family. Thank you.